How do cultural differences impact medical ethics? Have you ever thought about how culture shapes our views on health and medical care? Cultural differences play a significant role in medical ethics, influencing how ethical principles are understood and applied. Medical ethics revolves around core ideas like autonomy, beneficence, non-maleficence, and justice. However, these concepts can vary widely based on cultural values and social norms. For instance, some cultures strongly emphasize individual autonomy. In these societies, patients are encouraged to make their own decisions about their care. On the other hand, there are cultures where family or community decision-making is more important. In these cases, the patient's choice is often influenced by collective values. This can create challenges when Western medical ethics, which often focus on individual rights, meet cultures that prioritize family involvement. Let's look at specific medical practices to illustrate these cultural differences. Euthanasia is accepted in some Western societies as a way to relieving unbearable suffering. However, many Islamic, African, and Orthodox Christian cultures reject this practice on moral grounds. Similarly, views on abortion, organ transplantation, and surrogate motherhood vary greatly, shaped by religious beliefs and traditions. Communication styles also play a role in how medical ethics are practiced. In some cultures, doctors are seen as unquestionable authorities. This can make patients less likely to voice their concerns or preferences, which is essential for informed consent. Healthcare providers need to develop cultural competence, meaning they must understand and respect different cultural values while effectively communicating with patients. Cultural differences can also lead to moral distress for healthcare workers. For example, a clinician might struggle when a patient's family insists on withholding a diagnosis due to cultural beliefs. This can conflict with the ethical duty to be truthful and respect patient autonomy. So, what are some practical applications of these ideas in medical ethics? Involving family members in decision-making can be important when it aligns with cultural norms. Respecting traditional medicine practices and thoughtfully integrating them with modern treatments can also be beneficial. Assigning care providers in ways that align with cultural gender norms helps maintain patient comfort and dignity. Providing language support and culturally adapted consent processes ensures that patients understand their options and can participate voluntarily. Training healthcare professionals in cultural sensitivity can help reduce biases and improve care delivery. In summary, cultural differences requiring medical ethics to be flexible and sensitive to context. Balancing universal ethical principles with respect for moral diversity is essential. This approach helps ensure that ethical decisions are both morally sound and culturally appropriate, ultimately enhancing patient trust and care outcomes.